Hi, hello everyone, and good afternoon if you're in the East Coast like myself. My name is Vinita Chauhan Ramprasad. I'm a Director of Operations at Premier Inc., and I will be your moderator for this webinar. So thank you so much for taking time to listen to this webinar today. The webinar is titled zDesk, a remote, secure, and optimized work environment for healthcare. And I just want to let you guys know how excited we are to share this information about zDesk and what makes this such an exciting offering for both our healthcare and non-healthcare clients. Before we start, I want to tell you guys that there is a poll question on your screens. You should be seeing this right now. Please take a minute to answer this question while I go ahead and introduce our four speakers, four panelists for today. I'm going to start by introducing Ivan Durbach. Ivan is a senior IT executive for over 30 years. He has extensive experience in planning, development, and management of information systems applications, conducting IT audits, implementing IT security solutions, and re-engineering business workflows. Currently, Ivan is the CEO at Bronx Healthcare System. Bronx, as you all know, is one of the busiest healthcare systems in New York. It's an integrated delivery system. It has 2 hospitals, several emergency rooms, nursing homes, and outpatient clinic centers, and oversees about 1 million clinical services annually, essentially to a segment of population in the Central and South Bronx area. Bronx Care has been using zDesk for about 3 years. So Ivan would be talking to us about his experience with zDesk. Our second panelist is Andrew Peterson from Premier Inc. Andrew has been with Premier for about 21 years. Premier is a healthcare improvement company and unites an alliance of approximately 4,000 US hospitals and healthcare systems and more than 175,000 other providers and organizations. In his current role as the Director of Corporate IT and User Services, Andrew's organization is responsible for Premier's internal IT service desk, access management system, desktop support services, VDI services, and level 3 end user compute services. And these include enterprise support for Office 365 platform products that exchange online, OneDrive for Business, and Teams. End user experience and productivity are Andrew's most important areas of focus, and he works exclusively with the Long80 and Gavs team for zDesk use in Premier. Our third panelist today is Greg Dietrich. Greg works for HighBio and is a global solutions engineering manager at HighBio. He is deeply entrenched in VDI architecture and performance tuning over the last 5 years. Following a lengthy career as a systems administrator and veteran of the USAF, he has been working with customers for the last decade, evaluating and optimizing their overall IT strategy. And finally, our fourth panelist is Rajiv Khanna from Gavs Technology. Rajiv is the VP of Product and handles the healthcare portfolio, responsible for end-to-end service delivery. His expertise spans across service delivery, transition, transformation, and technology innovation, and Rajiv was instrumental in designing architecture and deployment of zDesk solutions to our customers, such as Bronx Care and Premier. So thank you so much again, all our panelists, for joining us today. Thank you for your time. Welcome, gentlemen. I will go ahead and actually give the results of the poll we just conducted. So majority of our customers are between either they have no VDI solution in place or they have a VDI on-prem. So with that, I would like to go ahead and start talking to our panelists today. So before we start diving deep into how organizations are using zDesk currently, Rajiv, I have a few questions for you, and these are kind of pretty rudimentary questions. I want to set up the stage for our discussion. So if you don't mind, would you walk us through what exactly is zDesk? And then again, how is zDesk, how is it different from legacy VDI solutions?
Sure. Thank you, Vinita. Hello, and thank you everyone for joining the webinar today. Before I get on to the details, I'd like to touch base upon desktop virtualization as a technology as it stands today. In this dynamically and rapidly changing era of digitalization and innovation, desktop virtualization as a technology has not quite rallied through that journey, and it continues to rather be a complex and an expensive proposition for organizations. We actually wanted to challenge that status quo and thus conceived zDesk by adopting an innovative but simplified and cost-effective approach that organizations can embark on. So let me get on to the question, what is zDesk? zDesk is a simple to deploy, a hardware agnostic desktop visualization platform that enables a secure and an unparalleled end user experience to complete an all-inclusive VDI solution. So you might think what an all-inclusive VDI solution means. Every VDI solution is all-inclusive. Let me get to that. What I mean by all-inclusive is that the core components of a typical VDI solution, which encompasses your hypervisor, your connection broker, your orchestration, the management and the control layer, they are all inbuilt into our platform, delivered right out of the box. So what is so different than a typical legacy VDI solution? In a typical legacy VDI solution, these are actually not integrated. These are actually systems or modules that are in a multi-layer architecture, requiring separate modules, the hardware that is needed to attach to these separate modules, third-party integrations that are needed, and the complexities that comes up with licensing of these different modules. So overall, this kind of architecture is very complex, of course expensive, and it requires a highly skilled technology team to manage a full-blown VDI stack, which is where most organizations suffer. As you can see with zDesk, next slide please, Anand. As you can see with zDesk, we are eliminating all these layers through a simple zero-layer architecture, which dramatically alters how you engage with the VDI solution. As in the slide that you see, we are replacing these team number of third-party providers, eliminating them into a single stack, and it is fully managed by a single interface. And that's the beauty of our solution when it comes to simplification. Now, let's quickly get on to some of the key differentiators of this solution. As I told you, it's a complete end-to-end platform with absolutely no overheads, no third-party vendors needed, no additional software providers that needs to integrate with you. It's an all-inclusive solution. And we are a very highly customizable product platform, to the level that we have a zDesk flavor just focusing on the healthcare portfolio. When I mean a zDesk flavor focusing on healthcare portfolio, we have built-in predefined healthcare specific user controls and policies that actually protects the uniqueness of the data and the PHI, PII that are involved in a typical healthcare scenario. And this is out of the box HIPAA and HITECH compliant. And as a technology, this is a bare metal install, which means you can get it up and running in less than a couple of hours for a fully production VDI stack, which is unheard of. Typical solutions today takes days or weeks for you to deploy, but it can itself spun up in about 2 hours. The solution is also the industry's only in-memory VDI solution, where the VDI is actually run on RAM for exceptional performance and user experience. And we are able to guarantee you the lowest cost of ownership across the industry for a typical VDI solution that exists in the market today. With all this uniqueness and the innovation that we have developed at the software, it quite doesn't complete the whole equation. And what we have done is we have layered around a managed services offering around this innovative software, and we provide zDesk as a service, desktop virtualization as a service, DaaS model, wherein which we are able to focus on an OpEx based pay-as-you-go model with the flexible deployment options, either on-prem or cloud, that gives you the convenience and the flexibility as to how you want to deploy the solution. At a very high level, that sums up what zDesk is, and that's how we have been disrupting the market and differentiating ourselves. Thank you. Over to you, Vinitha.
Thanks, Rajiv. So I just want to understand real quick. What you're saying is that zDesk is customizable for both healthcare and non-healthcare customers, correct? It has an extra layer of security added for sensitive healthcare data, but it doesn't mean it's only for our healthcare customers, right?
Absolutely, Vinitha. Since I said we are customizable, I gave this example from a healthcare perspective. We are able to customize it to any vertical or industry, and we have templates that allows us to be customized to the industry that we cater to.
That's great. Thanks, Rajiv. I'm going to move on to our panelists now. So, Ivan, I have a couple of questions for you. I understand that you're a current zDesk user. You and your team use zDesk very widely in Bronx Care. This is your first foray into VDI solutions, correct?
Yes.
So could you walk us through what needs were you trying to fulfill when you started looking for a VDI solution? And then what did you look at and how did you decide upon zDesk?
We started our journey about 3 years ago, slightly less than 3 years here, and we had 4 big problems at Bronx Care. We have an aging set of desktops here, 3,500 very old PCs because of the nature of our hospital, safety net hospital and the like. We don't refresh PCs every 3 years. That's best practice. We did every 5 to 6 years. So, and unfortunately, old PCs that fall apart and had to replace them. So I didn't feel like spending $3 million on replacing all these old PCs. Secondly, because they were old and frequently falling apart, we had poor customer experience. Our doctors and nurses were not happy that the desktop technicians had to come there frequently to maintain and support these PCs. Third big problem was security, because of the fact that without zDesk, we had to use a generic login to get into our Windows systems before we got into our EMR systems. And patching these old systems, so many XP systems around, patching was a nightmare. So those are several major problems that we had, and money was a huge issue. So we didn't like spending a lot of money. So we went out and looked at a number of major systems. Obviously zDesk was high on our list. We also looked at HP solution because we're a VMware shop. We looked at VMware solution. AT&T had, well, I thought, a pretty good solution also. But we settled on zDesk because high quality and it was very cost effective. So that's how we moved and that's how we implemented. And we've been on it now for almost 3 years, and we're generally very happy. zDesk came very, very handy to us during this COVID epidemic because, if you think about it, in many of our isolation rooms, when we had those close to 400 COVID patients in our hospital every day, we had, unfortunately, those bad days of April and May, about 30 COVID patients dying every day there. So when PCs did not work, getting into those isolation rooms was a big challenge.
Yeah.
We had cases where, the computer wasn't working, help, somebody come in, fix the computer in there. Our desktop technicians would show up. Sometimes there was no PPE, there was no face masks, what to do? We had stories of heroism where our managed service people went in there anyway, to fix the computer. So zDesk is a blessing. These computers, very little maintenance. There's virtually no moving parts to them at all. So from that perspective, it was a great blessing that we had zDesk when COVID hit.
Thank you so much for sharing that, Ivan. That is a really good experience to share. Thank you for sharing your experience with us. I want to move on to Andrew. Andrew, so you were kind of on the other end of this, right? Premier has been a VDI customer before. Tell us why you went looking for another solution. What was lacking in your previous solution? Why did you settle on zDesk, and how has your experience with the implementation been so far, and how do you feel now about the usage of zDesk?
Yeah, certainly. So yeah, Premier has definitely been involved with VDI. We've had VDI in the environment for about 8 years. So we've got quite a bit of experience in it. And let me kind of go through some of the use cases that Premier uses VDI for, and then I'll get into touching on some of the other questions. So the first use case we began with for VDI was moving a fat client data transformation application that we use off of our end user machines. Premier collects about 45% of all US discharges annually. So that's a lot of hospital data. And with that information, we have analysts that have to go in and normalize that data so that hospitals can make data-informed decisions around cost and quality opportunities, and also for federal reporting purposes. By moving this processing off the analyst's machine, it allows the staff member to kick off these jobs that they need to do, and then it leaves their laptop free to do other work simultaneously. And back when we used to work in the office, back in the day, we'll say, they'd be able to go from meeting to meeting without having to worry about dropping the network connection to the laptop. Another use case was, we provide member hospitals with direct access to that normalized data that we have through reporting tools. So we'll set them up with a VDI solution that they can get into with some reporting applications, and they can create their own custom report based on the needs of the hospital. So they can get a lot more value, direct value from that data. And the last use case I'll mention is around some cost reduction opportunities. So as Premier grew the number of online reporting products, we found that we needed to find some cost reduction opportunities, and we found that through utilizing offshore resources, both in development space as well as in performing some of the data normalization tasks, such as making sure ICD-9 billing codes were accurate and aligned. So in order to meet the strict federal regulation guidelines, we established the VDIs so that the U.S. hospital-based PHI data never left U.S. boundaries. So that's a requirement. So we started looking at zDesk as an alternative solution and out in the space because we started facing increasing issues with our performance and availability of our legacy VDI system. My team members were spending a lot more time on the phone with the vendor trying to address environment issues, and with less and less success, it seemed. So the mounting productivity issues began to become financially impacting through offshore staff productivity loss as well as SLA penalties. So to stay ahead of the business strategy as it shifted more and more trying to go offshore, we had to do something to address our challenges and productivity loss. So my goal was to find a service solution that could provide a stable and more responsive, fix for us. We looked through 3 different solutions when we started going through. What I saw were very similar offerings on the surface, but it would still require me to have dedicated staff that would have to create VDI images, maintain the new VDI, patch the OS, upgrade the software, all the common end user compute activities. So getting down to where it landed with zDesk was I was able to find a solution that allowed us to, reside within our own data center, which is very important for when we're doing development needs. We need to have proximity close to those data sources so that those activities could be done efficiently. And it was cost effective because I would be able to have the entire solution performed by the zDesk staff, and they would handle all the end user compute pieces of it. They'd work with the teams to make sure the VDI image was good, and that allowed me to pull back FTE staff and repurpose them to handle the other responsibilities within my team.
That's great. Thank you, Andrew. Ivan, so I want to understand a little bit about your team using zDesk now. How many users do you have on zDesk currently? I think we lost we can't hear you, Ivan.
Okay, can you hear me now?
Yes,
Sorry.
yes.
About approximately 1,500 users.
Okay, okay, great.
More, Rajiv, you may have more up-to-date information on that. But it's somewhere around there. I think we're going to be heading closer to about 2,000. We have 800 doctors, 1,500 nurses.
Great.
So that's there. So I think it's getting more higher than that number.
Oh, great.
Just to add to Ivan, it's 2,000 devices and 3,000 unique users on 2,000 devices.
Right.
Okay. Okay. So Ivan, what was your implementation experience like? Did you face any challenges and how did you resolve them?
Well, we did it as a two-step process.
Okay.
First step was that the most dominant and important application, of course, in all hospitals is the electronic medical record. That's where most of our doctors and nurses live, and clinicians and others live. So we just made very, very darn certain that the system was going to operate, no problems, and actually better performance. And we found that we had significantly better performance. So our clinicians were very, very happy when zDesk was rolled out. But most hospitals, they have a variety. We have 65 other systems in place, many of them smaller. So we had to choose our sort of battles wisely and move it out there. We found that there were some challenges with, especially with very old legacy systems. And we found in our finance area that they had, some of these accountants, they have monstrous, Excel spreadsheets, with all kinds of third-party apps. Wow, so that was interesting in order to do that. So we saved those for last. And applications that have a lot of multimedia, especially older applications, also had given us some challenges. So one example of voice character recognition, we use a common product called Dragon, but it's a very, very, very old version. And so that old version gave us problems, which were solved when we upgraded to a recent version of Dragon voice character recognition. So, but it's been on the whole a large success.
That's great. Do you want to talk to us a little bit about your experience of using the audio and video using zDesk? And Rajiv, I know you work closely with Ivan's team, so feel free to jump in and talk to us about that.
Well, the two systems I mentioned already, Dragon voice character recognition, which I think is probably well known and popular in the industry. We're just on an extremely old version of that. We also had like a smaller system to handle our dental clinic, remember, Rajiv, and they used a lot of Panax and X-rays and other kinds of that. Again, I think a combination of older legacy systems, these multimedia presentations, caused us to take more time in order to roll that out. But then finally, when we did roll it out, it gave tremendous performance improvement. Meaning, like doctors, dentists would take sometimes half a minute to bring up complex things. Now it's seconds. So I think the performance on our end users has been very, very positive.
That's great. That's great. So I do have another question for you, Andrew. How does Premier utilize zDesk differently from legacy VDI solutions to overcome security challenges and to align with healthcare requirements? Because obviously you're not a hospital system, but you're a healthcare company, and there are additional requirements that you would need to fulfill.
Right. Yeah, so I've already mentioned that, we have to keep the U.S. healthcare data within the U.S. boundaries for development and data processing. So that's a big challenge to start. Sure. Some of the biggest obstacles we had are how Premier's security posture has changed over the past year or so. Yeah. We've really gotten very strict. And with zDesk now, we're able to do things like use zDesk for mergers and acquisitions. Premier's gone through probably 8 or 9 acquisitions in the past, I think, 3 years. We usually go on site when we do day one IT type things. We can give out laptops, things of that nature. And we actually had 2 acquisitions that took place while we were in this this COVID challenge. Yeah. So what happens now is we're actually allowed to give newly acquired staff access to the Premier email and other applications through zDesk. We used to have it to where you could use almost any device and you could get, on Office web access, and our Outlook web access. That got shut down, right? That's a very big security risk. So now that we've done that and we don't allow access to any of Premier's content unless you're on a Premier asset, we kind of lost that ability to give staff what they need really quick. And there's activities that they need to do from an HR perspective. They've got to fill out a bunch of paperwork when they're acquired, things of that nature. So they got to get into our systems. So now within hours, we can literally get those IDs. We can spin up zDesk for them. We can get them set up to where they can get in to a customized, user-friendly, and secure environment so they can complete those activities. They can immediately get into their Premier email and become, Premier staff and feel like Premier staff and access intranet sites and things of that nature. But yeah, we've had the 2 acquisitions that I spoke of were both around 170 users that we had to get up and spun up for their day 1 activities, and we were able to do that effortlessly.
That's great. So my next question is both to you, Ivana and Andrew. And Ivana, I'll let you go first. But I have a question regarding, and both of you talked about cost savings. Could you give us an insight into cost saving? Did implementing VDI really save you money? And can you give us some insight on the ROI calculation upon zDesk implementation?
Well, without going through a very detailed and lengthy ROI, which we did, because at our hospital, nothing moves forward without a solid ROI.
Of course.
Yeah. And just 2 examples out of that are, as I mentioned before, to buy a new PC costs us about $800. A VDI box is only several hundred.
Yeah.
The PC, we stretch it out for 5 to 6 years. Most of the institutions 3 years. The VDI box lasts up to 10 years. So think of the large cost savings. Also support savings. So we could reduce our support staff by several FTEs by going VDI, because those several thousand VDI boxes, they have almost no moving parts. They don't fail.
Yeah.
And adding to that, Vinita, if I may take a quick shot at some of the other aspects. One thing that comes after the implementation of VDI is one aspect, but as part of implementing zDesk, how we are able to bring in the industry-wide lowest true total cost of ownership is because the way in which the technology is being utilized, right? So the underlying infrastructure that you would require for a zDesk would be 30 to 40% less than any of the other competing products that are available in the market. That's because software is at the forefront. You don't need a hyperconverged infrastructure or a storage visualization platform that helps you do the innovative things. Here, the software does it all for you, and most importantly, it comes right out of the box without you having to pay additionally. That's one thing. And second thing, some of the unique way in which the desktop is actually being demonstrated or deployed is another case where we are able to increase the user density per server by almost 30 to 40%. This is because using zDesk, you really don't need to have a persistent desktop given unless until it is a very specific use case. At Bronx Care, of all the 3,000 users, not even a single user uses a persistent desktop. Because we are able to do a non-persistent desktop with the persistent desktop experience, we are able to save a lot of resources there. So the amount of servers that I need to run zDesk is reduced, thereby giving you savings. So I think the software stack helps you generate the savings even before you deploy the solution. And then, as Ivan alluded to, you gain productivity gains and security outcomes after implementation. Thank you.
Thank you. And Andrew, did you want to add to that as well?
Yeah, I previously mentioned that I was able to reassign FTE staff to other support areas. Those support resources are really difficult to come by these days. So to be able to just free one up and not have to go through the process of asking for a new FTE or 2 FTEs is a huge savings, both from cost of having to go and identify and hire and all these other things. And so from that aspect, I think we're saving a lot. With all the offshore staff, I mean, we have hundreds of offshore staff that provide services for us. Luckily, we're able to utilize their thin clients. We don't have to go and provide that. It's part of the contracts that we have with these organizations. But the cost savings of being able to spin these up so much faster than our legacy VDI means that they can get up and running with a very specific built image that they can start day one and contribute, and not have to worry about adding additional software and all the other things. So it's been a really good experience from that standpoint, and obviously productivity, day one is very important.
That's
If
great.
I may just add one item that I shouldn't focus on, but the security aspects are also very important to us. I mean, we get pummeled, and that network attacks have increased 70% since COVID came along, and email phishing has gone up through the roof, and we are all so vulnerable to ransomware attacks. And without zDesk, using the old desktop environment, we were so vulnerable. XP systems, as I mentioned, patching was a nightmare. Now it's easy. We were all on our VDI service. So, yeah. And while it's difficult to quantify the cost savings, but it's a huge relief and savings, and not have to spend so much effort just monitoring the heck out of our security systems with zDesk.
That's great. Greg, would you mind giving us like a quick 10-minute overview of the application itself? And then I have a few follow-up questions, but I think we're doing pretty good on time, and I'd love an opportunity to actually see the application, get a brief demo.
Certainly. I'm going to turn my attention to my alternate monitor, so I'm going to put my video on pause here for just a minute.
Okay.
And I'd like to start off by kind of reiterating some of the things that our panelists have been talking about. Rajiv talked about the all-inclusive nature of the platform, and really, as he stated, there's a lot of VDI platforms out there that are all-inclusive. The key to our approach to VDI is that it's all-inclusive in a single installation. So from the time you installed the very first server, you have every aspect of the VDI stack, right? So when we look at a traditional VDI stack that has a separate management cluster that might include redundant database servers or redundant gateways, maybe some provisioning servers, things like that sit on dedicated hardware. Now we can free up those hardware resources, install as it would be called, like a workload host, and it has all the management features that you would expect to see out of a VDI platform. So I wanted to make that key differentiation that we are all inclusive, and it exists from the very first installation. And I think both Ivan and Andrew alluded to the simplicity of the platform, not directly, but indirectly, in talking about FTE savings, right? So we've built this platform to basically cater to two very distinct user groups. You've got your first user group that is your end users of the administration portal, which is what you're looking at here, right? So this is the admin user interface. And then you've got your other user group, and probably your most critical, and that's your end users of the VDI platform, the VDI desktops. So we've catered to both of those user groups in the development of this platform. And I'll go through some of the benefits for that end user administrator, and then go and show you the actual benefit from the VDI end user perspective. So what we're looking at here, like I said, is the admin user interface for the entire environment. Now through this portal, you control every aspect of the VDI stack, from your overall management of the environment to individual host management. So our hosts are just left of center here in a vertical alignment. These are your individual hosts, and you can manage those on an individual basis, maintenance mode, migrating workload, that sort of thing. So you can do that level of work. And then we've also included some key differentiators in the storage arena. Rajiv has already alluded to the industry's only storage and RAM, and our hosts, when installed with the platform, uniquely kind of carve out some RAM that's going to be utilized for primary storage, right? So I can take an entire VDI pool and plop it right down in RAM, and as you can imagine, the end user experience for those people using a RAM-based VDI would be extremely powerful, right? Extremely performant. And the other key storage consideration or differentiator is our hyperconverged is also built into this same user interface. So on the fly, I can create a hyperconverged platform out of multiple hosts, 2, 3, 4 hosts, and it's very easy. Again, we've really simplified this user interface. As you could probably tell, we put a lot of effort into making everything visual. Everything's a visual representation. So quite a departure from your typical or legacy VDI management where everything is in a tabular format, or there's lists, or there's alerts that you've got to read. Here we've really focused on how do we get information to the end user administrator in the most efficient manner, and that's through our visualization. So as you can see, as I hover throughout this environment, right, and hover over something, I now see the relationship between this. Here we have zDesk Stateless, so that's a VDI pool. So we see the relationship between it and the underlying resources all the way down to the host level. So me as an experienced administrator for this platform, I can tell you at a glance, takes me about a second, that the Stateless pool is running all in RAM and it's pretty evenly balanced across the host. And that's really the power of this visualizer, is to be able to relay to you some very critical configuration and operational information at a glance. And so that's our whole focus behind this kind of new aged visual experience. So another thing that we've done with the platform is integrate the performance dashboard into the same kind of user interface, right? So everything you'll ever do in zDesk is consolidated into this single portal. So if I wanted to look, for example, at the performance of my host or my VMs, I can go to the performance dashboard. And again, it's quite a departure from the norm, the way we present you the performance information. So here we're providing you the performance detail of every aspect of performance monitoring, from CPU to memory to the network I/O and storage I/O, all on the same dashboard. So now I can draw relationships between what's happening on the network or what's happening in virtual machine density, and how does that impact the rest of my host, right? How does that impact my memory? How does that impact my CPU? So now I can draw these very distinct relationships between what's going on in the host and how does it impact my resources. So again, back to the simplicity of the user interface, what we've targeted for our end user administrators is the IT generalist, right? Empowering that IT generalist that kind of is an IT administrator of all realms, be it servers, networking, storage, empower that individual to manage this entire virtualized data center. So what you're doing is you're taking the operations of your VDI environment and you're putting it in the hands of your level 1 help desk personnel. And I think Andrew alluded to that, as well as Rajiv, that we're empowering that group of administrators to manage the day-to-day operations of VDI. And that way it releases or allows your level 3 engineers to focus on the more detailed oriented parts of the VDI, like maybe optimizing a template or that sort of thing, or in completely different areas of the VDI platform. One thing unique to this platform also is the message bus, and that's what kind of gives us the peer-to-peer management style that we leverage here, rather than have a dedicated management platform. It's peer-to-peer, and that's all due to the message bus. And just real briefly, the message bus is kind of like a data pipe that exists between the host, and all of your telemetry data about the environment flows across this message bus. You know, Andrew alluded to or made reference to normalizing data as they ingest data for hospitals across the US. The message bus does the same thing in that all the telemetry from this environment is normalized because it's entirely owned by this platform, and so it's already normalized. So if you want to feed that into an AI platform or something like that, you can very easily do that because it's already normalized. And I think I'd like to kind of shift gears and show you now from an end user experience, what does it look like, right? We've kind of covered the basis of our end users from an administrative perspective, but what happens if I come in here as a zDesk user? What can my experience look like? So I'm gonna log in here. Give me 1 second. So I'm logging into this integrated broker gateway, right? It's all part of the installation, right? If I want to enable this, I just enable that in the broker configuration, and it basically establishes this new website. So my users log in, they see this presentation of their different desktop pools that they belong to. Here, my zDesk user has one user group or one desktop pool, and it's called zDesk Stateless. I'm going to click on HTML5 to gain access to it. Let me center this HTML5 browser, and now I'm on my desktop. It's literally that quick. And I want to draw attention here to the HTML5 interface. This is really powerful in that it's going to allow your users to leverage really any access point at their discretion, be it, you know, a mobile phone, a tablet, anything with an HTML5 compatible browser now has access to their virtual desktop in their environment. I can recall a number of times I've been out away from my desk and I get a call and I've got a remote into one of my desktops for administration purposes. So I pick up my mobile phone, I access a really tiny virtual desktop, and I'm able to make those changes. So it allows me to kind of break the chains that tie me down to the office and provides that really flexible client for our end user community. Rajiv, is there anything that you'd like to add?
I think you have quite captured both the admin user and the end user perspective. So we, apart from the HTML5, what are the other delivery mechanisms that you support in our product, Greg?
So there is an RDP gateway built in, so we can support native RDP, which again, any computer that has an RDP client, as well as an HTML browser, they can use this. We also have an installable Windows client, installable end user client that really streamlines this whole process, almost like the HTML5 interface where you enter your username, password, and you're in your desktop. The installable client has that same look and feel. So bypass the browser entirely. It's launched as a local application on your computer.
And Greg, one question: if I have to use the RDS-based client, would I also be able to use it from a non-Windows endpoint?
Absolutely. So anything that you can install an RDP client on. So you can go to the Apple Store and download the Microsoft RDP client. I've got it running on my Pixel phone. So really anything that has an RDP client available, we're going to leverage that native capability to access that desktop. So RDP is going to be encrypted from end to end, right? So it gives you a very secure tunnel between your end user and the actual virtual desktop.
All right.
Thank you so much, Greg.
Absolutely.
Absolutely. So I do want to remind our audience that there is a chat window available to you. If you have any questions about the product, please feel free to ask us. I do have a couple of questions that have come in already, Rajiv, and I wanted to direct those to you. one of the questions is zDesk offered only as a desktop as a service model? And then also there's a question about private or public cloud. Does zDesk operate on private cloud or public cloud? And then finally, there are questions about pricing models. So could you give us kind of a brief idea about what pricing model for zDesk would be?
We take pride in being very customizable and to the users or customers' request. So the answer is no if it is just only a DaaS model. But the recommendation is if you go into a DaaS model, you get the benefits of the end-to-end stack. But we have done in multiple clients a hybrid version of the DaaS model where in times the hosting or the other aspects may lie with the customer, but typically it's customizable and the benefit lies in the user's environment and how they want to do it. And when it comes to the deployment model, we are able to deploy it on-prem, like what we have done at a Premier. We have used their on-prem location, but we are doing a managed services, providing the server, the managed services, and the end-to-end aspect of it. At Bronx, we do it on a private cloud, totally managed by us, starting from hosting, connectivity, and everything. So it can be a combination. And we also support public cloud, but it has to be a bare metal public cloud, like IBM bare metal, stuff like that. We don't recommend operating in on Azure or AWS, which already has a hypervisor.
Did you want to give us a quick update about the pricing model?
So pricing, it's again unique based on the customer needs, but the start basic version of zDesk as a service model with hosting and the end-to-end management starts at around somewhere about $30 per user per month on an OpEx model. But again, this is only indicative. We would be more than happy to work on a customized model which can bring it down, or depending upon the need, it will be updated.
Great. So I'm going to change lanes a little bit. And Ivan, I have a question for you. You touched a little bit on this already. I want to talk, we all know we're not living in normal times. You touched a little bit about how COVID has affected healthcare. You were kind of in the epicenter of the crisis. Would you talk to us a little bit about that? And then how have you seen things change from where we were just earlier this year to where we are now as healthcare in our nation? And then moving forward, what do you see changing, for healthcare, and how do you think services like VDI could help support those changes?
Well, clearly, the COVID experience has ushered in a whole new world of telehealth.
Yeah.
Before, it was limited. There were payment issues, payment process. Basically, the governments and the insurance companies couldn't pay for it. So we didn't move. Now they are, and we're moving very, very dramatically. But I think what COVID showed us is that we and our partners, we have to have a lot of flexibility and creativity. And just to give you one small example out of many, that at the height of it, here we had this big problem that clinicians to go into a room where there were COVID patients, we had 400 of them every day. They would have to, put on PPEs, masks, then they come out, then they got to take them off, do it again. So it's a lot of wasted time. So and time is precious to them. So our partners put in iPads on wheels, not just to help with the communication process with patients expiring and no visitors to be allowed, but also with the physicians being able to check in on a patient without having to go through that extensive process of donning the gear. And actually, I never forget that our desktop engineers and our people came back to me and said that we put the iPod, they wanted it in the room, we put it in the room. The doctor spotted directly that a COVID patient was coding a death, and they were able to rush in and save the patient. And so here's this technician telling us that I helped to save a patient's life today. The doctors told me I saved the patient's life. That was huge. You know, they never had that happen. But that's sort of an emotional part of that process. But I think on a going forward basis, the last item here, zDesk provides for simplicity and also much less support. And we need that in our environment, especially as we get into deeper and deeper into telehealth.
Great. Thank you, Van. Greg, I do want to ask you a quick question about pandemic, and I meant to ask you this while you were giving your demo, but were there any changes that you made to zDesk specifically targeting the pandemic and issues that arose from that?
Yeah, certainly. So as you know, as COVID broke out for everybody, there was this extreme push for everybody to work remotely, work from home. So due to kind of an overwhelming response from our customer community, what we did is develop the ability to broker physical desktops from a remote location. So let me define physical desktops for you a little bit. Physical desktop is anything that's RDP capable, right? So Vanita, it could be your laptop in the office where you get the call and say, Vanita, you can't come in today. We've got a work from home initiative. So how do we support that end user base that has abandoned their desktops, their laptops, that sort of stuff in the office? So we've created the ability now to configure the broker to automatically, publish like your desktop in the broker. So you could sit at home, log in, click on the icon for your desktop, and you're at your laptop, right? So you've got the same software suite that you've been using. You're on the same network that's very familiar to you. There's no disruption in your day-to-day. So that's probably the biggest thing that came out from a technology perspective for the VDI stack.
Thank you. Andrew, did you want to give us a quick kind of overview of how the pandemic affected working at Premier? And I know it's, again, not a hospital healthcare system, but an organization that supports hospitals and healthcare so profusely. So could you give us an insight into how the pandemic affected your team, and moving forward, what changes do you see happening, and how do you see products like zDesk supporting those changes?
Sure. Yeah. Kind of unlike Bronx Care or other organizations that use desktops, we're really more laptop based. Our workforce is about 50% remote or flex based prior to shutting down the offices. We moved within 2 weeks from being in our normal state to completely all offices are shut down. So there are a handful of desktops that we had to get some laptops out to and things of that nature. From zDesk, it's good because if we have any staff members where their laptops break and we need to replace them, it could be up to 2 days. We've got a company that handles our laptop replacements, and if we have it in within a certain time, they'll get it to them the next day. If you're living in a remote location, that automatically becomes 2 days, and if we miss the time frame, it could be a 3-day. So if they happen to have a home PC, we're able to quickly just assign them a zDesk instance. They can sign into their OneDrive, at least have access to their email and all their documents, and be productive during that time. I think going forward, I mean, we have the ability to from Premier's perspective, we have the ability to kind of lean on the ability of zDesk to not make those refreshes happen on the laptops. We're typically at 4 to 5 years for a refresh. We can make that go a little longer if we want to. We could change to thin client laptops, or any other type of device. And that will help reduce the overall cost for Premier. Some challenges with some of our people that take flights and things like that. So there will never be a time where we are in the foreseeable future we'll be able to use a thin client laptop on an airplane and allow people with connectivity. It just wouldn't be good, but we should be able to reduce our overhead costs with our laptop refreshes. I'm hoping that we can start outfitting our offices when we return with, more dumb terminal type of scenarios. And if we can get buy-in from our security team and HR, legal, all the other teams involved, move to a position where we can start doing BYOD, and then I eliminate that cost altogether, and we just give people a stipend for their device, and they always use zDesk. We never have to worry about data loss prevention from the aspect of a laptop that doesn't get returned or get stolen.
Great, thank you, Andrew. I do have a few audience questions coming in, so I'm going to toss this. Either Rajiv or Greg, feel free to jump in. There's a question about, is there any feature consideration for data security? And then kind of a follow-up of that, can you tell us a little bit about centralized data management?
So I think Andrew kind of alluded to this in what he was just talking about now. And this is really indicative of VDI as a platform, and that's to remove that data security loss, right? In the case of a lost device, right? A lost laptop, misplaced laptop, stolen laptop. I've heard the stories many times from our customers where, my laptop was stolen and all of my stuff was in my VDI, in my safe. And the answer is yes, right? Because especially in Premier's implementation of zDesk, there's no ability to copy paste data from within your VDI session to outside your VDI session. There's no provisioning allowed to plug in a USB drive and transfer data that way, right? All of your user data, even when you're in a stateless desktop, is saved in a centralized repository for that user, which we call user volumes. So there really is no way to pull data off of that system. Now the system can be flexible, right, for those other businesses or corporations that want to allow that flexibility, maybe for their internal users who are sitting at a thin client accessing a VDI. They can allow copy paste or USB drive redirection, right? That's built into the product as well. But security from zDesk is all about separating the user from the actual data set, which remains in your data center.
Great. I know we're actually coming almost to time. There are a few more audience questions. What I do want to say is I'll remind the audience that we will get back to you about these. If we're not able to answer your questions right now in the webinar, we'll make sure to get back in touch with you and answer your questions. I'd also like to encourage you to visit our website. I think we have a slide about that, Anand, but it's www.long-80.com. If please take the time to look through our website, look through our offerings. There is an email for inquiries, so make sure you email us if you have any further questions. And then you can also experience zDesk. So there is a link given to you for that. Please feel free to go use the virtual experience for zDesk as well. Lastly, I just want to thank all of you so much for your time today, and thank you for your support. Thank you for your partnership, but above all, thank you for taking time from your busy schedule to talk to us today about this. Rajiv, I didn't know if you had any closing remarks. I just want to say thanks again to our audience members for your time. Rajiv, I'll hand it back to you.
Okay, thank you, Vinita. I think, as you said, due to the time limitation, we would get back to some of those interesting questions around the future roadmap and other aspects. We would definitely get in touch with you. Apart from that, thank you so much for your time. And we would be more than happy to have a session with you for a deep dive demo and or a proof of value. And we'd be more than happy to work with you on the use cases. Thank you once again.
Thank you, everyone. Have a good day.
Thanks
Stay safe and stay healthy.